So there were several posters on Risdiplam, all the fishing poster, rainbow fish, firefish, sunfish. On rainbow fish, the study in pre-symptomatic patients is just starting, so nothing else to say that it's starting, including patients with 2, 3, and 4 copies, even if the primary outcome would be measured in patients with 2 copies. In firefish and sunfish, the studies conducted in type 1 and type 2, there's a very interesting feature, is that the population that is studied is quite an old population. So patients in firefish have an average age of 6.3 months in the second cohort, which is quite old for SMA type 1. And patients in the part 1 of sunfish, so the study in type 2 and type 3, were aged between 2 and 24 years. So there is data in patients who are quite old in comparison with the other medications. And that's something interesting out of these studies, is that a significant effect can be observed in these patients despite the fact that they are quite old. So patients in sunfish, in firefish today, there is about 40% of patients who have acquired the sitting position in the second cohort of firefish. And in sunfish, there's an increase in a scale that is called MFM that we did not observe in a natural history conducted just before in the same centers. So this is very encouraging data, but of course we need the confirmation in a double-blind randomized placebo-controlled study, which is the second part of sunfish currently ongoing. So if Risdiplam is approved, it's probably going to increase our ability to fight against spinal muscular atrophy, because it will offer the opportunity of treating patients with an oral medication which is quite easy to handle in comparison with other approaches, and with a medication that has bring some efficacy data in all the population. If sunfish part 2 turns out to be a positive study, then it means that we will have a medication that has demonstrated its efficacy in patients aged up to 23 years. So it's going to be quite a good improvement in the treatment of patients with SMA type 2.